This week we are covering chapters 7 and 8. So to start with, we'll quickly go over chapter 7, safety considerations in medication administration. So hopefully you are able to see my screen as I go through the chapter textbook. So first thing they talk about is medication errors. And so medication error is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. And so these can be related to the following situations. And as a healthcare professional, namely a nurse, it is our job to prevent medication errors if at all possible. So, in the next paragraph, you'll notice in 2001, a study showed that human factors such as performance or knowledge deficits accounted for 65% of patient deaths from medication errors. So, 65% was just basically human error. So as we learn to do dosage calculations this semester, hopefully we can reduce that human error by accurately calculating dosages and learn how to administer them safely. So they list several different organizations involved in safe medication practice. The USDA is one of them, the public health agency that oversees the safety of consumer products such as medications. And there's been several legislative efforts throughout history, starting with 1906, that deal with drugs and medications. So you can read through those. And then it goes on to list additional organizations that are involved in medications. We've talked about the Institute for Safe Medication Practices when we talked about abbreviations earlier, what to use and what not to use with abbreviations. Joint Commission, you'll probably hear a lot about, especially if you already work in healthcare. They drive a lot of policies and procedures in facilities in regards to safety, which includes medication administration. So different medication delivery systems, they talk about unit dose systems and multiple dose systems. So you need to make sure, are you dealing with just a unit dose or multiple doses, single use only or multiple use in your medication samples. Automated medication dispensing systems. This picture here, you'll see the woman at an automated medication dispensing system. This one in particular is Omnicell. They help reduce errors a lot. They have a bunch of different safety measures in place to help you realize that there's an issue or something going wrong or something just doesn't add up. And there's another instance of a storage cabinet that has medications in it. So preventing medication errors, how are we going to do that? The 6 rights of medication administration and 3 checks that we do in addition to that. So nurses should use the 6 rights of medication administration when preparing and administering medications. You're also going to check the medication labels against the medication administration record, which we'll talk about in a little bit, at least 3 times before we administer the medicine. So by doing all these checks, it doesn't guarantee that we're not going to make any mistakes, but it's going to greatly reduce the incident of mistakes. We're all human. Humans make mistakes, but through careful consideration and the use of these checks and reviewing the rights of medication administration, then hopefully will greatly reduce those errors. So the thing I want you to know, if you ever do make a medication error, the first thing you're always going to do is report it. Just make sure you go through the appropriate steps to report that error, and there are a series of things that you'll have to do depending on your facility or unit that you're working on in regards to following up about that medication error. So right number one, the right patient. So we have to identify our patient and make sure we are giving the right patient the medication. Okay. So there's different ways that you can do that. You can have the patient state their name. You can compare it to their armband, or you can scan their armband with barcode scanning with those automated medication dispensing systems. And then there are other ways, that you could do this as well. But those are the main ways that you would identify your patient. So the next rights include the right drug. So obviously we want to administer the correct medication to our patient, and there are things to consider: drug names that look alike or sound alike, drug labels that look similar or misleading, poorly written prescriptions, and we've talked about how doctors' handwriting can sometimes be messy, errors in transcribing the medication to the medication administration record, lack of knowledge by the care provider about the medication being prescribed. When we deal with medications, it's important to know that medication has 3 different names: a generic name, a trade name, and a chemical name. Now, in healthcare, we're most likely going to be dealing with the generic and the trade name, not always the chemical name, unless we look at the prescribing pamphlet with the medication, which we don't always do. So, for example, they give you Tylenol. Tylenol is the trade name, or the brand name, for the lack of a better word, for the generic form of acetaminophen. And the chemical name is N-acetyl P-aminophenol. So a mouthful for sure. So trade name or brand name is Tylenol, and you'll notice that trade name is capitalized. So the trade names or brand names are always capitalized, and the generic name is not capitalized, and in this case, it is acetaminophen. Now, it's important for you to know that a medication only has one generic name, okay? There could be multiple trade names for the same medication. So think of ibuprofen. Ibuprofen is the generic name, and some trade names that you would have for ibuprofen would include Motrin and also Advil. So those are probably the 2 most common names that you might be familiar with, Advil and Motrin. So those are both trade names for the same generic form, ibuprofen. Okay, so hopefully that makes sense to you. You can go to this website, www.ismp.org. It's a very informative website, and it will include pages or charts on look-alike and sound-alike medications, how those could easily be confused, as well as you'll see the abbreviation lists of what not to use on there as well. So a lot of good information on that website. So here's a couple of examples of how the ISMP has worked to try to reduce errors. So they have taken the action to recommend that the different lettering would be capitalized or in all caps to easily distinguish between those 2 names, like bupropion versus buspirone. So by quick glance, you just might see the first 2 or 3 letters and think that, oh yeah, this is that medicine, when in fact they're 2 completely different ones. So by placing a form or a portion, of the words in all caps, hopefully that will reduce incidences of error. And of course, the automated medication dispensing systems will help hopefully reduce some of that. But keep in mind that humans are loading that medication into those cabinets. So, pharmacy might come up and load the medications into the drawers of the dispensing cabinet, and they might mistake the name of the medication and put it into the wrong compartment. And I've personally had that happen to me. I went to give a medication, and it was actually the wrong medication in that drawer. So things happen. We're all human, right? Okay, number 3. the right dose. So administering the incorrect dose of medication is one of the most common types of errors. So things that could contribute to an error: poor handwriting. We've talked about examples like that, and placing a zero before a decimal point and not a zero after a trailing zero. Incorrect transcription of the dosage from the order onto the medication administration record, use of unapproved abbreviations, and the availability of highly concentrated drug products. So, for example, this heparin, you could actually give an incorrect dose by saying, oh, we got to give 1 milliliter of heparin. Well, if you take 1 milliliter of the top heparin in orange, you're giving 1,000 units. And if you give 1 milliliter of the bottom heparin, you're only giving 100 units. So that could be one way that you could have a medication error. In addition, you want to make sure that the dose that is prescribed is within normal limits. And we're going to look at that a little bit later when we come back to class. We'll look at a drug resource, a drug handbook for nurses, and we'll look at different medications, and it will tell us what the minimum and maximum doses are for each medication. And so we want to double check the provider's orders to make sure that they are within the correct dosage. As nurses administering medications, we are the last line of defense in safety before that medication is given to the patient. So it's a lot of responsibility for us to try to make sure that everything is correct when administering the medication. So, right number 5, we'll go back to the top in a minute. Right number 5 is the right time. So we want to make sure we're giving the medication at the time prescribed. And sometimes the medication is the prescription might say give once daily or give as needed or something like that. And that's a little different. But a lot of times we'll be on a schedule, like it might say every 6 hours. And so each facility is different, but they usually have a standard time that medications are given if they're ordered twice a day or 3 times a day or 4 times a day, etc. So another thing to know is in most instances, the medications must be given within 30 to 60 minutes of the scheduled time. Otherwise, they're considered early or late. So you want to give them between that 30 to 60 minute window of when they're scheduled. Okay. There are medications that need to be given the same time every day. For example, insulin is one that we would need to give every day. Birth control pills, I recommend to give the same exact time every day, just to keep that same level of medication in the patient's system. And of course, you need to use your judgment in administering medications, and sometimes that will mean withholding medications. So for example, if you're supposed to give your patient a blood pressure medication and their blood pressure reading is really low, then you're not going to give that medication, because then you're going to bottom them out and they could have adverse reaction or code, possibly worst case scenario. So there are instances where we would use our nursing judgment to potentially withhold medications or make sure it's safe for us to give that to them. Right number 6 is the right documentation. So there's a saying in nursing: if you didn't document it, it wasn't done. So you always, always, always document, and document correctly anytime you give a medication. So you're going to include in your documentation, whether it's electronically or on paper, the name of the drug, the dosage, the route, and what time you gave it. And then you're going to initial it or sign it with your credentials at the end. So you see a couple examples there of documentation of medication administration. Okay. So going back up to the top, different forms of medication, of drug formulations, different solids, they could become available in tablets. Everyone should know what a tablet is. And we might see SR, excuse me, SR, XL, ER, CR, LA, and those are formulated to be slowly released over time into the body. We might see chewable ones. We might see enteric coated, like the ibuprofen we talked about earlier. Most ibuprofen is enteric coated. It's got a coating around it to prevent it from being dissolved in the stomach and causing stomach irritation. You might see capsules, caplets, lozenges, and on as far as solids. Liquids, commonly you'll see a syrup or an elixir, suspension, solution, lotions, and ointments are semi-solids. Okay, so different routes of medication administration. Oral is by mouth. So typically we give tablets and capsules and liquids by mouth. Rectally, we can give suppositories. Can also give suppositories vaginally. You can also give them by a tube placed into the stomach or small intestine. We can give liquids. We can give tablets that can be crushed or capsules that can be opened. Okay. There are medications that are not to be crushed. And if you see this box right here, do not crush drugs. As a rule of thumb, do not crush medications that are enteric coated, or if they're extended release, or they're fizzy, or will provide a foul taste in the patient's mouth. Okay. So you will see the complete list of do not crush medications on that ISMP website. And also that information should be in your drug book most of the time. Okay. Parenteral medications. Parenteral basically means outside of the GI tract. So we are giving intravenous, intramuscular, subcutaneous, or intradermal. So intravenous means IV. I think everyone's heard of IV medications and knows what an IV is. Intramuscular is basically an injection or a shot into your muscle. Subcutaneous is just into the skin, and that first, that layer of the skin, and then intradermal as well. Okay. Topical is basically on top of the skin. So by direct applications with creams, ointments, and lotions, or you might have patches that are impregnated with medication. Okay. So nicotine patch, for an example. Other routes, inhaled droplets or fine powder, such as a albuterol inhaler for asthma, sublingual, and I mentioned vaginal already, and then intrathecal, which would be an epidural or spinal injection. So several different types of routes of medication administration. So 3 checks that help enforce the 6 rights of drug administration. The nurse should check medications at least 3 times prior to administering the drug to the patient. Okay, so check the time, the name of the med, the dose against the MAR, and do that while you're pulling the medications from the drawer. Check the medications with the MAR after all the medications have been obtained, but prior to entering the patient's room. Now, being young, you're probably thinking, well, I might have 1 medicine or 2 medicines, but some of the chronically ill patients or older population, they might have 6 to 10 or more medications that they're receiving every med pass. So you might have a lot of medications that you're having to check. And then number 3, check the medications with the MAR at the patient's bedside after you ensure that the right patient is about to receive the medicines. Okay. And then it goes through the barcode medication administration in the 6 rights. And basically that's just the electronic version, and you're scanning the patient's identification bracelet, you're scanning the medicine, and then that automated medication dispensing system will alert you if you're giving a patient to the wrong or medication to the wrong patient, or if you're giving an incorrect dose, or if you need to, for example, split the pill in half before you give it. A lot of times that system will alert you to those different things. It's not going to completely prevent errors, but it definitely helps preventing some of those errors from occurring. So medication reconciliation is a fairly new thing, and you'll notice this says 2018 is when the Joint Commission made a policy basically on it. It's to identify and resolve discrepancies between current medications and those that the patient should be taking. So, the process of medication reconciliation includes comparing prescribed medicines with current medications to look for allergies, duplications, omissions, interactions, contradictions, or contraindications, and the need to continue medications. So, some patients will have several different doctors taking care of them or involved in their care while they're in the hospital, and they might discontinue a medicine, some might add medicines, and so it can get very confusing to not only the patient but the nurses even, while the patients are in the hospital. So the medication reconciliation just double checks and goes through the orders, through the home medications, and making sure that the patient is receiving all the medicines that they're supposed to be and not receiving medicines they're not supposed to be. So the nurse's responsibility are, when a patient's admitted, we complete a list of all of their medications, their home meds. It's going to be prescriptions, over the counters, any vitamins or supplements they take, everything that they take. And then throughout their hospitalization, then they will double check those, to make sure there's orders by their provider that they're supposed to be getting those. And then when the patient is discharged, they make sure they get a list of all the medicines that they're supposed to be taking once they get home. And the same thing happens when they're transferred to another facility. They'll have that list with them, that medication reconciliation list, that should be correct. So abbreviations used in medication administration. We've talked about some of these before. And like I said, you can find this list on the ISMP website. We talked about the microgram abbreviation or symbol before. So we don't want to use that because it can be misinterpreted. This says it might be mistaken for milligrams instead of micrograms. So you can imagine if someone thought it said milligrams, then they're going to get an overdose of that medication if they gave the same amount in milligrams instead of micrograms. CC, remember, we're not going to use that. We're going to use milliliters instead. HS means hour of sleep. It might be mistaken for half strength. And then QD, QOD, you see all of this list of what on the left-hand column is what the abbreviation or symbol is, and then on the right hand is what we should be using. Okay, so this is what we don't want to use on the left. What we should be using is on the right. Okay, so please go through that list and make sure you're familiar with it to reduce incidences of errors. So here's some acceptable abbreviations, symbols, and dosage designations. So you can read through those as well. And then that is the end of that chapter. So chapter 8, prescriptions and medication orders. So prescriptions, they might be handwritten by the doctor or the prescribing healthcare provider, or they might be computer generated. Ideally, they're computer generated to reduce error, and most often are sent electronically straight to the pharmacy. The exception is usually for a narcotic. A lot of times you'll still get a paper prescription for that. So on that prescription, there needs to be specific things, and you see those listed here: the superscription, inscription, subscription, signorata. And those need to be included on the prescription, so there will be the correct medicine, the correct dose, the correct directions included with that medicine. So medication orders, who can write them? You might see a physician, physician assistant, nurse practitioner, dentist. different providers can prescribe medications, but they have to have legal authority to, and they have to be registered with the Federal Drug Enforcement Administration and their appropriate state agency. Okay, so need to make sure that these are legitimate prescribers. Components of a handwritten medication order. We want to make sure that the patient's identifying information is on that prescription, when the prescription was written, the name of the medication, the dosage of it, the route of administration. So they need to know, are they taking it by mouth? Are they taking it in IV form? How is it going to be administered? And then how often and the time it's supposed to be administered. The prescriber's name and credentials, and the name of the person transcribing the order, if that's applicable. Components of the electronic medication order are basically the same. And then special types of medication orders, we might see some orders that are one time only. So they only want the patient to have the medicine one time. They might have a stat order. Stat means like now, basically as soon as possible. So a stat order is usually a one-time administration, one-time order as well. Standing orders are pre-written, and they're basically a standardized set of instructions for a patient with a certain condition. So, for example, if you go to an OB floor, you're going to have a set of standing orders for a postpartum mom or a mom that's had a baby within so many hours. So like if you've had a postpartum vaginal birth, a patient would have a set of standing orders, and they're going to have, so many milligrams of Pitocin IV. They're going to have docusate sodium. They're going to have a certain pain medicine. They're going to have all these different things that are standing because those generally are the things that all of those patients need. And the PRN order is just as needed. So you might have maybe some nausea medication administered PRN, or some pain medication or sleep medication PRN. And those orders are only if the patient needs it. So say for some reason they're having trouble sleeping and they have a PRN order for Ambien or some other type of sleep aid. They might not want it every night, but if they're having trouble sleeping, then they could request that. The patient could. And then the nurse does not have to call the doctor to get an order for that. It's just in case. So it's kind of an anticipated need with a PRN order. So ordering and transcribing medications, you're not going to be able to transcribe or do any telephone orders as a student. You have to be a licensed nurse to be able to do that. But verbal orders, they only need to be done in an emergent situation. So like in an ER or maybe during a surgery or something like that should be the only time, or maybe a code situation that you would give or receive verbal orders. Handwritten meta orders must be legible and complete. The order should be printed, not written in cursive, and should contain all the necessary components we listed before. So it goes over the do's and the don'ts of taking verbal telephone orders. One important thing to know is that you always want to read back the order that was given to you to make sure that you understood it correctly. So the medication administration record used to document medications administered to a patient. And then once the doctor or prescriber writes a medication order, it's transcribed or written onto the medication administration, or the MAR, by either the unit sec or the nurse. Okay, so the nurse is going to double check that order that's put on the MAR with the original physician's order or provider's order, and then they'll send that order to pharmacy. So pharmacy will send that medication to the floor, to the unit. Okay, so several different steps have to take place before that medication can be given. So each facility does have its own design of medication administration record, and you'll notice that once you get into the healthcare setting. But they have to have essentially the same information. Obviously, the patient information, so their name, their room number, date of birth, whatever identifying information that's unique to them that can be on there. Any allergies to medications, of course, that's going to be very important. We want that to be readily available to us so we don't administer anything they might be allergic to. We'll need the current date, the time that the med is due to be administered, specific administration information, maybe, and then identification of the person administering medication, so that once you give the medicine, as the nurse, you would sign an initial that you had administered it. Okay. So the MAR is a legal document. It's part of the medical record of the patient. So it's very important that it's done correctly. So here's just some samples of a medication administration record. So you don't want to sign off on the MAR that you've given a medication until you actually administer the medicine. Because if you say, oh, I'm going to walk in the patient's room and give all of these medicines right now, and you just sign before you ever go in there, you might get into the patient's room and the patient might refuse a medication. Or, like we talked about earlier, if their blood pressure was too low, you're not going to give them their blood pressure medicine. So there are several reasons that you might not administer a medication. So only initial and sign off on the MAR that you gave a medicine after you actually give it. Okay. So there's some additional MARs, some case study information and key points. So that quickly went over chapter 7 and 8 for this week's lecture. Obviously, there's no math associated with these two chapters, so they should be fairly easy questions for you. I will say for chapter 7 homework, to not confuse you, there is no worksheet that you're going to download before you enter your answers into the homework exam. And basically, it's just abbreviations and what those abbreviations mean. So I entered that into the directions for your chapter 7 homework that you can see. So if you have any questions over chapter 7 or 8 this week, don't hesitate to give me a call, leave a message on my office phone, or send me an email. I imagine we'll be back on campus on Monday. So I hope everyone's staying warm and safe, and I hope to see you next Tuesday.